Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Hi, I'm April Bean, and welcome to the Totally Adequate podcast. I'm so glad you're here to join us today. This is Luke Hansen, I should say Dr. Luke Hansen, who is a clinician. Luke, you want to introduce yourself to the audience?
Yeah, sure. I'm Luke Hansen. I'm the Chief Medical Officer at Arcadia. We're a data integration and analytics company. My clinical background is in hospital medicine. That means I'm an adult internist who works in the hospital. I tell patients when I'm admitting them that if you don't need a surgery, you're coming to see me. And then I've worked over the course of my career as a CMO for population health at a large provider system here in the Chicago area where I live, as well as for United Healthcare as a CMO for Medicare Advantage for the state of Illinois, and at Optum as the clinician on the care management product team for that organization.
Fantastic. I'm so glad you're here with us today. And then next to Luke is Shanna Adamic, and it's hard to get through your titles for you, but if you would introduce yourself as well to our audience.
I'm just Luke's assistant. No, I'm kidding.
We're collaborators.
I'm an author of Audacious Optimism, a speaker. I speak around the world about audacious optimism, and then I also am a content leader for Oracle, where I lead Oracle TV, and I'm also anchoring Oracle TV, where we track transformation and the stories that are changing industries, and specifically right now, AI. And I have a special passion for healthcare.
So Shanna, you had quite the medical journey. Could you tell us just, a quick snapshot of that? I don't want to shorten your story, but I do want to give everyone a little bit of a feel of what that 6-year long journey, medical journey that you had. What happened?
Yeah, thank you for asking that. Bird's eye view of it is it's 6 years, 109 engagements with primary care physician specialists in an ER. And that was a 6-year journey of trying to find answers with symptoms that started with hearing loss, going all the way to aphasia and being misdiagnosed and underdiagnosed and misinformed. And it's important to also know that my journey actually ties into a career I was having, what I did as an athlete. I started on the sidelines of the NFL for nearly a decade, cheering in the loudest stadium in the NFL, go Chiefs, and alongside a growing career with a company who was digitizing healthcare. So I was experiencing the EHR as it was growing and as we were creating it. And so, on that journey, I start there because it was being the cheerleader that actually led to me being misdiagnosed so often, because my hearing loss was attributed to cheering in the loudest stadium in the NFL. And that felt right until the moment it didn't. And then the growing symptoms that kept coming. And then every single appointment I went to, I started to realize I had this incredible diary that was happening, but nothing was being connected. So all of the different appointments, all of the referrals to the specialists who maybe weren't the specialist in my care, until finally getting to the point where I had to push one more time and telling my story a bit differently to get the answers I needed in the just-in-time moment that was going to save my life with a brain surgery that did just that.
Dr. Hansen, what do you think about when you hear Shanna talk about a journey like that, the missed referrals, the lack of information share between all the doctors that caused her to go through a 6-year journey like that?
Yeah, I mean, I think I hear it through I see it through a couple different lenses. The first is, as a clinician, there's a saying in clinical medicine that when we hear hoofbeats, we think horses. But it's not always horses that make hoofbeats. There are zebras out there. And our brains are not particularly attuned to think that way. Like, we think of what is common. And so as a primary care doctor, you're going to see first, or think you see first, the things you see the most. As a specialist, same thing. Thankfully, specialists go farther down that list, but still sometimes it can take a long time to get to the right answer. I would say, like, as someone that's been involved in the administration of care, that fragmentation that you're talking about, the discontinuities of information are kind of fundamental problems in our industry. And then lastly, I guess I would say, as a person, as a human who also has had healthcare journeys, the frustration that you experience when you feel like no one really knows you and no one really can get to the bottom of what's going on, even if you think they believe you, which often is also an issue, that people don't feel heard or don't feel respected. Like there are all sorts of issues around that as well in care. But if you do feel like you're saying what you're feeling and it's not leading to progress, that's incredibly frustrating. And so I sympathize with what you experienced.
I had a physician tell me once, who's also a friend, who became a friend. She's one of my neurosurgeons. And she actually said to me, she said, those who are in my shoes as a physician or anyone on a care team actually feels the same frustrations you do, because we're also patients and we see those moments that we're also stepping into that. And then we're on the other side where we see the demand and we're trying to keep up with it and everything there. So it really is there's so much complexity in healthcare. And I think that's why,
Mm-hmm.
we're in this new era where it's maybe truly becoming for the first time an intelligent era of care, because we're attempting to get rid of some of this noise that we created. And it's going to happen at every level. I think it's probably the most excited I've personally been about shifts in healthcare. Would you agree?
Yeah, absolutely. The pace that this change will happen, I think is TBD. And it will probably happen slower than either you or I would want it to. But yes, we are absolutely now enabled with emerging technologies to better diagnose, better treat, better understand patients, both their medical problems, but also who they are, what their context is. And by having that knowledge, I think we can design treatment plans that are much more effective than what we've been able to do in the past.
Well, our audience here at VQ are working on provider networks. They're the backbone of the networks that we all go to for care, and I think it's really important for them to hear from both of you how the networks that they build and the data behind those networks really does impact the end care that's given. There is they have a human impact. They're not in the clinic, right? They're not the ones taking the care, but they're creating the networks to make it so you can get access to the care that you need.
Yes.
Yeah, I would say that we've talked about this, that there are networks conventionally defined, which is to say, what are the physicians that you have contractual access to? But then there's a more pragmatic view of what a network is. You may have a physician contracted in your network, but that doesn't mean access. And even if you do have access and you can get in for a visit, it doesn't mean that the care you're going to get is high quality care. And so, I'm of the opinion that we need to not only think of networks in terms of who's contracted, who do you have contractual access to, but you have access to great doctors, and we should do a good job of highlighting who the great doctors are. Whether we call that a network in the conventional sense or not, there is this cohort of folks out there that you would want your family to see. And the more we can create transparency around that, the more I think it'll lift all boats.
Absolutely. And I have to say, this is coming from that passionate side of mine, but I think healthcare, above maybe any other industry, no matter what part of healthcare you touch, you can be mission driven. And it's because we are part of a big web. We are part of a big complex system, but every single piece is so critical that it can honestly be mapped to one single life changing, one single person being connected to the right care, one single story changing. And I think that's what's so different than any other industry. And so when we think about those people who are sitting in those chairs in your community and the work they're doing, they're important, because when you think about it like that, access isn't transactional. Access is very personal. And so, is it the good doctors? Is it the right doctors? Are we being sent to the right specialist? Is it the right care? And so it's so important that they have that same mindset as well, that we all believe we're in it for one mission, and that is to transform healthcare. Because you've heard me say this before, it's the one thing that unites us. Every single person will experience it. So what healthcare do you want to experience?
I think that's so true. And that is going to resonate with the audience so much. Thank you for coming on the podcast. We look forward to having you on the VQ stage. And thank you, everyone, for tuning in. We appreciate that you have picked the Totally Adequate podcast. I know you have a lot of other choices you can choose from. Please comment. Please leave remarks. Tell us what other topics you'd like us to cover. We do this for you. I want to thank Fowler House Films for producing today's show, as well as our producer, Sophia Timmermeyer. Thank you.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate Podcast is produced by Fowler House Films, Sophia Timmermeyer, and Quest Analytics.